Hello, everyone. This is Dr. Anthony Cave, live and unscripted, to talk about Parkinson's disease in the light of Neil Diamond's recently talking about his struggles with Parkinson's. And as always, there is an operating room story that also fleshes out how important this is. And I had a patient recently who was having sedation because we typically try to avoid general anesthesia for reasons we'll discuss in patients with Parkinson's. And under sedation, this patient was opening up, like we talked about, the body opens up under anesthesia. And we had a pretty deep conversation about their not only acceptance of their diagnosis, which is very profound. This is not an easy diagnosis for anyone to handle. Just look at the cases of Neil Diamond, Robin Williams, Muhammad Ali, etc. But more importantly, they had the wisdom to accept this. But they did express very much so their wish that there could be education about the potential causes and what could be done to prevent Parkinson's. For them, it was too late, but for their kids and for the millions of others worldwide that are exposed to chemicals that might well be triggers or catalysts for the development of Parkinson's. And I see everyone coming on. Thank you, Steph, Darian, Linda, Donna, everyone. I appreciate all your kind comments. And this is a really fascinating topic because when I ask my patients, or when patients ask me, really, what are the most feared conditions out there in medicine, neurodegenerative diseases are one of the most common, along with cancer, along with some autoimmune diseases, in particular, because we don't have any treatments for any neurodegenerative diseases. And we'll talk about Parkinson's, what is available, what works, what might not work. But the term an ounce of prevention is a pound of treatment really rings home for conditions like Parkinson's. Similarly, for Alzheimer's, ALS, if we had any type of prevention or treatment for it, certainly. But for Parkinson's, we're learning more. And recent discoveries of contributing chemicals that we're going to talk about suggest that maybe we can prevent these really debilitating diseases from ever happening in the first place, which is good because we don't have good treatments. Now, first off, Neil Diamond, Muhammad Ali, Robin Williams, Michael J. Fox, Brian Grant. What do all of these celebrities have in common? They have a common condition, diagnosis, or had, past tense, of Parkinson's disease. Certainly, this affects more than just celebrities out there, but these celebrities are making it known and they're advocating, which I'm really happy about. Parkinson's disease, what is it, right? And when you go through medical school, there's three cardinal features, and they are tremor, rigidity, and bradykinesia. What do these mean? The tremor you've all seen. If you look at Michael J. Fox, for example, there's clear tremor typically in the hands, could be in the head, it could be anywhere in the body. The bradykinesia refers to slow movement, brady and kinesia. Brady, like when you say bradycardia, bradypnea, that's for slow. Kinesia refers to movement. So when you watch people walking with Parkinson's disease, they typically are walking slowly with a shuffling gait, etc. And then this rigidity. In medical school, the classic thing is called cogwheel rigidity, where if you get their arm and you try to extend a patient with Parkinson's arm, it goes clunk, 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 clunk. It's not smoothly extending. Now, later stages of Parkinson's can just have tonic rigidity throughout the entire range of motion, but the classic that you see early on in diagnosis is this clunk, like a cogwheel, boom, 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 boom. However, Parkinson's affects way more than just the movement. Yes, it's a classical movement disorder, but there's a lot more that we don't talk about. And that includes things like dementia, psychosis, sleep disturbances and insomnia, mood disturbances, autonomic dysfunction. And what is that? This is really important, right? Because as you know, nothing in the human body is siloed. Nothing, certainly the mind and body are connected, like we talk about in this channel under anesthesia all the time. But even within the body, just like how anesthesia affects all the nerves in your body, neurodegenerative disease tends to also affect all the nerves in the body. Now, specifically, there's a group of nerves in the brainstem called the substantia nigra that are affected. However, all nerves can be affected. We'll talk about the substantia nigra in a moment. Those are involved in dopamine production, which is deficient in patients with Parkinson's. But the autonomic disturbances come because all nerves are affected. So the autonomic functions, your blood pressure, your heart rate, etc., these can be affected as well. So people can pass out when standing up too fast. Their heart rates can go up, can go down, can do unusual things because those nerves are also affected. Now, I mentioned the substantia nigra, as you can kind of guess from the name, substantia, substance, nigra, black containing or black colored, is literally, when you look under a microscope, it stains very darkly with traditional stains, and that's why I call it the substantia nigra. These are cells that produce dopamine, and dopamine is actually critical, not just for addiction, like we talk about usually on this channel, but also for movement. A lack of dopamine, we believe, is directly causal for many of the symptoms that we see. Like I said, tremor, bradykinesia, rigidity. And it's not by accident that giving dopamine in the form of levodopa, carbidopa, et cetera, these can help restore normal movement up to a point. The problem with Parkinson's, and this is what I want you all to recognize, because this is the hallmark of this whole concept of an ounce of prevention is a pound of treatment. I'm going to say that one more time. An ounce of prevention is a pound of treatment. Because when a patient comes to me and they already have symptoms, it's too late. We don't have any ways of regrowing the cells in the brainstem to produce more dopamine. Once those cells are gone, they're gone. Everything from here on is going to be ways that we try to artificially boost dopamine. Like I mentioned, the mainstay are going to be just giving dopamine in various forms that the body can absorb, and so that it can cross the blood-brain barrier, and give medications that reduce the breakdown of dopamine so that it lasts in the central nervous system longer. There is deep brain stimulation. By stimulating certain parts of the brain electrically, we seem to also be able to relieve those symptoms. But when those cells are gone, they're gone. And that's why the whole point of this talk is, what is this new chemical that increasing evidence is being found for that might help prevent the symptoms, that might prevent the dopaminergic cell depletion from ever happening in the first place? And Neil Diamond's case certainly is raising more awareness, which I'm really happy we're doing, because all of us here are subject to these same chemical triggers. And it breaks my heart that we don't talk about this. That patient who is getting anesthesia from me is like, I've come to terms and acceptance, which very, very powerful, very, very wise elderly patient. But I'm going to acknowledge his wishes. Let's spread awareness, and that's what this is about. By the way, a little shameless plug. If you're learning something, I would appreciate it if you hit the like button and share what you learned with others, because the more knowledge that you have, as you know, the better you can advocate for yourself. And in our medical system, especially in the West and the United States, patient advocacy is by far the most important thing. So I really hope that you're learning more so that you can advocate, be more in control of your health, because you have more control over your health than you've ever been told. And what we're going to talk about now is actually directly relevant. And by the way, Donna, Slatsy, Heidi, Linda, Darian, Michelle, it's so good to see everyone on here. Steph, thank you for all your kind comments as always. So Parkinson's is different, we believe, in other neurodegenerative diseases because it appears that there are environmental toxins that have very direct effects. Yes, genetics probably accounts for a double-digit percentage. We believe in the range of 15%. So that means of all patients with Parkinson's, a genetic cause was probably responsible for about 15% of them. So that's obviously a minority. We believe, we don't know yet, that the majority of Parkinson's disease probably comes from an environmental factor. And the first evidence is actually fascinating. In the 1970s, there were some cases of chemically induced Parkinson's disease. Has anyone ever heard of this? It's no longer around in our time because this chemical was actually a hard drug. It was a cheap form of meperidine, or a cheap form of Demerol. Demerol we use in the operating room still today, and I'm sure many of you have heard of it. Demerol is a synthetic opioid. It's one of the most dangerous ones because physicians abuse Demerol because of its anticholinergic properties. It's not like opium. It's not found in nature. It was actually first developed as an anti-allergy medication because it has anticholinergic properties like your Zyrtec, like your Benadryl, etc. But by virtue of having the anticholinergic properties, it actually masks the pinpoint pupils. And it's really sad, but docs would abuse meperidine because they wouldn't have the pinpoint pupils that you get with fentanyl, with oxycodone, with Dilaudid, etc. So anyways, it's synthetic, and then Some people found a cheap way of making the synthetic opioid even cheaper, and there was contaminants in the Demerol. This is crazy, that caused Parkinson's. This is the first evidence that I'm aware of, at least, that showed that, wow, you can chemically induce Parkinsonism in young, healthy people, young, healthy drug abusers. So they found what the contaminant was. It's not, we don't really use it for much of anything today, but it showed a model that, wow, you can actually give a chemical and you can cause Parkinson's. You can kill these sensitive dopaminergic producing cells in the substantia nigra, in the brainstem. Well, fast forward years and years, and there's another chemical. This one, unfortunately, is not just found in cheap synthetic illicit drugs, but it's actually found all over the world in refrigerant solutions and chemicals, especially in degreasers for electronics cleaning. Gosh, it's all over. It's called TCE. Stands for trichloroethylene. TCE, trichloroethylene. Unfortunately, this is all over the environment. Trichloroethylene is even here where I live in Silicon Valley because it was such a powerful electronics cleaner. Well, in Silicon Valley, lots of electronics production, et cetera. It's actually all over the groundwater, soil, and even indoor air pollutants. TCE has not only been linked, at least association-wise, to certain cancers, esophageal, non-Hodgkin lymphoma, kidney cancer, possibly liver cancer, but also most recently Parkinson's disease. And a real heartbreaking story comes from Camp Lejeune in North Carolina. So I don't know if you guys have heard of Brian Grant, an NBA basketball player, very talented, who developed Parkinson's in his 30s. I want to say 34, something incredible. I mean, this is not the normal course of Parkinson's, where it typically affects the elderly. Well, where did Brian grow up? Camp Lejeune. His father died of esophageal cancer, which we believe may have been related. He grew up swimming in lakes, just totally contaminated with this stuff. So we don't know for sure, right? It's hard to prove causality. But like I said, when we don't have any treatments for something, and we have at least what appears to be some solid, the number is cited around 500x increase in risk of Parkinson's when you have these exposures. Now, it's hard to say exactly how much exposure you need, but gosh, the fact that this is in our drinking water, in our soil, in the air potentially, if it's indoor pollution, what can we do to help minimize this exposure? I see people here talking about Demerol here. Now, Donna, just to be clear, Demerol, when used in a medical facility, does not have this contaminant in it. This was found in illegal Demerol, cheap contaminants of cheap Demerol out in drug users. So don't be concerned about getting Demerol in the operating room and having a risk of Parkinson's. Unlikely at all. Susan's asking, was that given for migraines? Well, I don't think that they gave TCE for migraines. Demerol, yes, there was once used for opioids and migraines, not recommended anymore. Now, like I said, 15% of all Parkinson's we believe is genetically related, but 85%, I mean, these numbers are going to be rough, right? But more than half, certainly. By the way, just like for cancers, we believe that more than 50% of cancers are lifestyle modifiable. I'm not blaming patients. I'm recognizing that we have incredible power to overcome a lot of these dangerous, scary diseases that we don't have cures for. Inherently, Parkinson's affects the energy producing parts of the cell, the mitochondria, and it looks like TCE, these contaminants from Demerol, and also pesticides can interfere with this energy production at the mitochondrial level to contribute to the depletion of these dopaminergic cells. So what's the take home? Well, for the pesticides that I mentioned, we don't yet know exactly what pesticide. If we knew, we'd probably be more vigilant in banning it, but we're not very good at recognizing this in the United States yet, unfortunately. But certainly eating organic whenever possible, I advocate for. Yes, are there organic scams? Of course. Are there places that say they're organic that they're not, but they're not? Yes, of course. But if one can afford it, if one has the opportunity, is it worth it? I believe so. I recognize that Yes, a lot of people say, "Oh, you're a privileged, doctor, you have access to it, etc." I hear you on that, but I'm just saying, if you're a patient, if you have access to organic fruits and vegetables, and it's economically feasible, recognize that probably the greatest waste of food money goes to wasted food. If one can maybe be less wasteful of food, they might be able to save enough money to afford organic food. This is a big socioeconomic. I understand social determinants of health are huge, especially for Parkinson's. I'm just pointing out one action item that we can all at least be aware of, hopefully can act on. Now, what about the TCE exposure? Well, personally, I use a reverse osmosis system because I don't trust the water. Even in San Francisco, we have Hetch Hetchy sourced water. I don't trust it personally. I'm not saying I don't want to be a fear monger for anyone. Of course, if you don't have access to any other water, I'm not saying to go into acute kidney injury by dehydrating yourself because you want reverse osmosis water. But my point is that there are ways that we can try to be mindful of contaminated water that might, this chemical, I don't know if it makes its way through various, I mean, every municipality is different. So it might make its way into your drinking water depending on where you live, because every county in the United States has different types of pollutants in their water supply, and some of them make it through. You can look at all this stuff up on EWG's website. I highly recommend that you do that. And if possible, consider filters that actually filter out what's in your water supply, because Brita filters, nothing against Brita as a company, but they, at least for the contaminants in San Francisco's water supply, they don't actually remove those contaminants. So a lot of people have these Brita filters thinking they're doing themselves good. And in many municipalities, it's actually not filtering out the concerning chemicals. So EWG has a list of all these chemicals. They've done a very good job. And I recommend that you feel empowered when you get a chance. Put in your zip code, look at what's in your water supply, and look if your filter filters out what's in your water supply. Now, indoor air pollutants, I always advocate for having an open window when possible. And if you have a vacuum cleaner, try to get one. Hopefully, everyone has a vacuum cleaner, but you want to get one that has a HEPA filter. Remember that dust from electronics, dust from anything is not benign. This dust accumulates, whatever is inside your sofas, inside your carpets, inside your electronics. You want to vacuum regularly. You want to filter all that garbage out whenever possible. I'm not saying you necessarily have TCE in your home, but these are action items that we can be mindful of. Dust is not benign, especially in our modern day living with electronics everywhere, where this dust ends up accumulating whatever is coming off of these electronics with all sorts of potent pollutants. And before we go on to your questions, I want to emphasize that there is so much emphasis that I get from people in the Bay Area, a lot of patients in particular, that are like, they want to health optimize, like, oh, what supplement should I take? Or let me take this stack of this microdosing, or, stuff that we don't have evidence for, stuff that's kind of a little bit out there. I'm not saying it's bad. I totally support a lot of this, but not at the expense of looking at what can we optimize first. We don't want to be penny wise, pound foolish for our health. We want to look at what exposures can we first eliminate, because prevention is ounce of prevention is a pound of treatment. And then we can look at, specific treatments and modalities to help improve our well-being and, by taking extra supplements. But let's first prevent the toxins from coming in. And where do they come in? The food we eat, the water we drink, the air we breathe, obviously the clothes that we wear, etc. Right? But being mindful is the first step. Not fear mongering, but being mindful and advocating and recognizing that there are lots of great organizations, EWG in particular. They don't pay me for anything, but they have lots of free resources for you all to empower yourself so you can advocate for your health with the decisions you make every day for your kids, for your parents, and for yourself. So remember that you have more power over your health than you've ever been told. We're going to go into questions now. I might cut this out of the final video on YouTube to not bore people, but I see so much activity here. I would love to answer your questions. Okay, so Darian had a teacher in elementary school whose husband had this. I'm really sorry about that. Jump in the World says this is very scary for disease. It absolutely is. Heather says, had my 6th elbow surgery on Wednesday under general. Had problems with long QT ever. What can cause this? Typically, long QT, if you're not born with it, it's acquired from the medications that we give. In particular, Zofran is one of them, but there's many long QT prolonging medications used. I hope that the rest of your recovery went okay. Um, Slatsy, thank you for the kind comments. And Irene, thank you for this. I know a lady in my church. She's about 72. I just didn't understand all of what she's going through. Thanks again. Thank you, Irene. And I hope that your 72-year-old fellow churchgoer um, gets that love and compassion now that you hopefully appreciate a little bit more about what she's been suffering with. Lone Star, I'm concerned about receiving C19 vaccinated blood. I am not familiar with C19 vaccinated blood. Sorry, Lone Star. Okay. Do I buy bottled water? Asks Linda. I typically don't because I don't know what's in the plastic bottle of it. Like I said, I use a reverse osmosis system that I installed with, it took me about 1 or 2 hours. Not a very good handyman, but figured it out. I trust that more because I actually read through the spec sheets for what's filtered out, and it is by far the most effective at filtering out pollutants that are in the water supply. So reverse osmosis or RO. Is distilled water the best to drink? Jumping the world. Distilled water certainly has a lower chance of having contaminants in it by virtue of the distillation process, but what is it being transported in is my concern. I don't know what is in the plastic that's leaching into the water. Once again, not being a fear monger here, but recognizing that it's not just the water, but whatever packaging that it ultimately receives or you get it in might be leaching stuff out as well. Very good question. Michelle says fasting is so healing. It's free, actually, saves money. Also, there's so many cheap super healing products. You are correct, Michelle. Most of these superfoods are actually rather inexpensive at the grocery store, despite the perverse incentives that we have for garbage food. Healthy foods are often still cheaper. And by the way, I also would appreciate it. Another shout out if you wouldn't mind hitting that like button and sharing with others or subscribing if you haven't. It would mean a lot to support me in this. All right. Pickles 007, you're correct, looking at BPA. Recognizing that BPA is only one of many synthetic concerns in plastic, but it's still better if you can to avoid BPA. Once again, there might be a lot more in there. I like to drink water out of glass bottles when feasible, but it's not always feasible. Heather says they wouldn't even give me Zofran because of the long QT. Yeah, so maybe there was another medication that you were given earlier that had QT prolonging agents in it. Susan says, I don't know if many people know of the medicine that can give Parkinson type symptoms. I can't remember the name, but I had to stop it. I had all 3 symptoms pretty bad. Not knowing more about you, Susan, I don't know what medication would have caused that, but certainly getting illegal cheap Demerol on the street would be one thing to avoid. I hope you're not doing that. I'm sure you're not, but I don't know what other medication you're referring to there. Just kidding says you had a George Siegel thing going on. Just kidding. Is it bad if I say I don't know that reference? I'm really sorry. Sorry. I feel silly. Maybe you can explain it to me. Just kidding. I like your username, by the way. Does lion's mane help with this disease? Lemuria, not to an appreciable degree. Lion's mane, I recommend to some patients, does have some cognitive benefits. They're very, very mild and moderate, realistically. But when you combine lion's mane with the right social interactions, with the right sleep medicines, like right sleep hygiene, with the right mental health, with the right nutrition, now you can have a powerful integrative cognitive optimization health plan. Not just the lion's mane on its own while you're drinking caffeine all day and sleeping 5 hours a night. You probably know that, but just to be clear. All right. And Slatsy is asking a question that isn't on topic. Slatsy, you can ask it here or you can ask it in the Discord. Great question. Pickles. Aren't some using electronic brain stimulation? Yes, we talked about DBS or deep brain stimulation, recognizing that it is an imperfect method and there's risks of implanting hardware in your brain or in your skull, but certainly compared to untreated Parkinson's, it's something worth considering. How do I give medication to someone who needs anesthesia that has Parkinson's? Oh, very, very good point. I forgot to bring this up. Linda, when somebody has Parkinson's, we are particularly concerned about the effects of neuromuscular blockade or paralysis or weakness if they're already weak. If they're not moving very much, we cannot use succinylcholine because of the risk of hyperkalemic uh, cardiorespiratory failure. So we typically avoid succinylcholine in some, but not all cases. And if possible, we like to do the procedure without muscle paralysis and without general anesthesia if possible, because the risk of aspiration is very high. So we can't use LMAs because when you have, like we said, neuronal atrophy that's affecting your autonomic function may also affect the involuntary muscles that would prevent you from aspirating under anesthesia. So these are high aspiration risks in end-stage Parkinson's, high risk of succinylcholine-induced hyperkalemia, and there might be a prolonged recovery from neuromuscular blockade. We don't want someone to wake up weak without being able to breathe fully. So those are the main considerations for Parkinson's. We always recommend continuing Parkinson's medications. Um, those are, yeah, so that's why if we can do surgery with sedation, that's what I prefer. And this patient that I started out this discussion with, I didn't want them under general anesthesia. So we could do a nerve block and sedation as opposed to general anesthesia. That's what makes it safer. Just kidding. I will look up. Oh, George Siegel. Yeah, I am. I am familiar with that case, bypass surgery. Yeah, I will look that up as well, though. And Michelle, I've heard of synapsin, a nasal spray prescribed and compounded can help with Parkinson's and ALS. I am not familiar with synapsin nasal spray. I will look it up. Thank you for letting me know. Irene. Hey, good to see you again, Irene, on here. And no one had ever called my name. You're so kind. Oh, well, my pleasure. We don't know how to help. So, how many people suffer? Yeah, and that's why, like that patient said, if we can raise awareness for potential chemical exposures and pesticides, TCEs, synthetic meperidine analogs, all the more awareness so we can advocate for ourselves. Oh, Susan says Reglan. Yes, Reglan can cause similar symptoms. Very interesting you brought that up. We don't use Reglan in patients with Parkinson's. I should have answered that for Linda's question. I never give antidopaminergic medications to patients who have Parkinson's. Reglan is a common one. Reglan is like a synthetic form of ginger, by the way, that helps with gastric emptying to minimize nausea, possibly reduce the risk of aspiration. I give it to patients who are going to be giving birth to help if they're going to have a C-section emergently, give them a bunch of Reglan so that if there's food in their stomach, we help facilitate it leaving. It's typically very safe when used as a one-time dose, but if you have Parkinson's, it can totally, at least theoretically, induce Parkinson-like symptoms because it's antidopaminergic, compounding the lack of dopamine that you already have in the brain. Very, very good point. I forgot to mention that. Thank you, Susan. If you give sedation, will they still shake? Very good question. Very, very good question. Typically, the tremors stop with sedation. That's a very interesting point. Yes. Yes. Very, very good question, Linda. Thank you for answering that. Now, certainly, if you're under general anesthesia with paralytic agents, you're not going to tremor as well because the skeletal muscle is literally paralyzed. Susan says, I've aspirated before. I'm very sorry to hear that, Susan. And perhaps that's why you're familiar with Reglan, because Reglan can potentially reduce that risk. I also give Pepcid in patients with Parkinson's. They don't have any other contraindications to minimize the stomach acid. And actually, specifically, I did a video today showing what acid looks like. You should check it out. I put an orogastric tube down someone's mouth who had bad acid reflux, and I suctioned a whole bunch of acid. It's very gross looking. and very dangerous because that pH is like 2.5. If you aspirate that into your lungs, they can be devastating. It'll burn your lung epithelium and can be lethal potentially. Um, they offered Reglan with the IV cocktail. Yes, Warrior Arm. They often give Reglan because it helps people feel less nauseous. We give it for migraines as well, and often in the emergency room. It's used a lot, and it's likely safe in one-time doses here and there, but cumulative dose can lead to permanent tardive dyskinesia, and that's the concern that we have for repeated use. Ginger doesn't have that concern. It's not as potent as IV Reglan, but is very safe when used over time, unlike Reglan. Pickles. Are meds linked to causing Parkinson's like some home meds causing Alzheimer's? I'm not aware of any prescription medications that can lead specifically to Parkinson's. Reglan can lead to tardive dyskinesia, which is different than Parkinson's. Antipsychotics run the risk of permanent tardive dyskinesias. It's a lot of like this. If you see people that used to take old antipsychotic medications for years and years and years and years, they do this with their lips a lot. Or they have the tardive dyskinesias, which you can also Google to see what those look like. But they're in some ways similar to Parkinson's symptoms, but they're not depleting the dopamine that we're talking about that is fundamentally Parkinson's. Great questions. Slatsy is having strabismus surgery. Has a tendency to wake up during surgery. It will be under general, but I'm terrified since it's my eyes. Very good question, Slatsy. Tell your anesthesiologist your concerns. It's very unlikely to wake up, especially for strabismus surgery, because we want to keep patients very deep so that they don't move, because moving can be potentially catastrophic if there's a knife near your eyeball when they're adjusting the rectus muscles around the eyeball. So it's likely that your anesthesiologist will keep you quite deep and really reduce the risk of waking up. Very good question. I wish you the best for your surgery. Ahmad, my question is that does it commonly pain in the area where spinal anesthesia was injected, like a month after, for like a few seconds? Ahmad, it's very rare. I can't say it's impossible, but I would also want to know maybe what was the spinal anesthesia used for? What was the surgery? Is there anything else going on in the area like muscle spasms? Has there been any other injuries to the back? Any neurologic symptoms? There's a lot that goes into that. I can't obviously answer without more information. But if you have any concerns, of course, you can talk to your doctor. I am Devil Woman. Good to see you. Doctor gave me sumatriptan for migraines. I've had since my TBI surgery. Do I need to be worried about Parkinson's? I've heard bad side effects from this medication. Sumatriptan can have side effects. They're typically cardiovascular. And actually, I don't know if this is a very serious point actually, but long-term migraine medications can lead to what we call medication-induced migraines, which is why triptans should not be overused for many reasons. But the migraine one in particular, it's like you're trying to treat migraines, but the medication may actually facilitate the development of migraines. We don't quite understand why. Likely from, as you know, my view of health is that when you're giving exogenous medications, you tilt the body in a certain way. The body tries to re-express or overexpress receptors to compensate, and potentially there is pathology that arises from that. But I don't know if we know yet why triptans over time can cause migraines while you're trying to treat them. The cardiovascular risk, it appears to be for older forms of migraines, but I'm not a migraine expert. I will just mention that overusing these medications can have risks, not Parkinson's-related risks, as far as I know. Good question. Connie, very good to see you. Oh, and first time on a live. Thank you so much for the kind comments, Connie. I appreciate it. Can akathisia look like Parkinson's? It can, but that's why you need to look at the other. You have to specifically look at the tremor. You end up doing an MRI in most of these cases with Parkinson's as well to look for any other clues that might be causing the motor deficits. Good question. I'm Devil Woman says, I have a friend that did the lip tongue thing I just showed after taking a cough syrup. Oh, interesting. I hope it got better. Was told not to take it until I have a bad one. I have 3 plates in my head, subwoofers, I call them. Oh, I am Devil Woman. I'm sorry that you've had that, but it sounds like you're taking it in good stride. Very powerful. Alan Smith, please discuss conflicts with ketamine in people with atrial fibrillation or high blood pressure. Well, not on topic for Parkinson's, but yes, Alan, I do give ketamine to patients with atrial fibrillation and high blood pressure as long as I monitor them closely. And I am personally with them, and I have the appropriate rescue medications as appropriate. It's always about risk benefit. If somebody with hypertension, atrial fibrillation, of which I've had many patients, is suffering from treatment resistant depression that will increase their risk of cardiovascular disease long term, risk of premature dementia, increased risk of suicide. Well, the risk of ketamine potentially exacerbating their atrial fibrillation in a way that I can treat with beta blockers, calcium channel blockers, is pretty low. But if you don't have access to an anesthesiologist or an emergency room physician, then no, I would not take ketamine in a therapist's office who doesn't have an IV and able to immediately treat that if it happens. Very good question, Alan. Damn it, Janet. I like your username as well. I'm having VAT surgery tomorrow. Frightened. Damn it. I'm wishing you the best for your VAT surgery. She's having a large, minimally invasive, but still a serious surgery in her chest. I hope everyone here is sending her positive vibes. Do please check out my videos on how to be at peace before surgery to help reduce your risks of postoperative pain, postoperative depression, hopefully fewer side effects from anesthesia, lower chance of blood clots and infections. I'm wishing you the best. It's a challenging surgery. Ahmad says, for my knee ACL surgery, I feel a sharp pain when I fix my posture. I'm not aware of there being consistent data that suggests that spinal anesthesia for ACL surgery, for example, leads to that. However, it's always a possibility anytime there is any disruption of muscle fibers like that for a spinal anesthesia. I'd recommend that you speak with your surgeon, Ahmad, or your anesthesiologist. I suspect that if it is related to the irritation from the needle placement, it should resolve within a number of weeks or months. But of course, I can't give medical advice, as you know. Thank you, Heidi, for sending, damn it, Janet, positive vibes. Adrian says, how can I prevent Parkinson's? We just talked about this. You can rewatch from the beginning, but since the vast majority of Parkinson's appears to be from environmental exposures that we're still learning about, but it would certainly follow the precautionary principle to reduce exposure to TCEs and pesticides when possible. Good question. Could ketamine be a good option in patients with Parkinson's? It can be. I use it from time to time. Yes. Linda has occipital neuralgia, migraines. I have surgery. Never worked. I don't take meds because nothing works. Linda, I'm sorry. And then, like we talked about before, I hope that you can find a holistic healing center around where you live in Texas. Heather, would long QT be something that would prevent someone from being able to get ketamine treatment for PTSD and depression? Not in and of itself. No. Very good question. But I would have them with EKG monitoring throughout, potentially, depending on how long the long QT is, whether it's congenital or acquired. That's why you need to have a doctor that knows. I mean, there's many places that will just do mail order ketamine. I personally am skeptical about the safety and efficacy of this. I want to know my patients. I don't want to be prescribing them something as potent as ketamine over the phone or over the internet. I care for my patients directly in person, and there's no substitute for that, especially not around mental health when patients have felt abandoned so many times before. It's so important to have that connection, I believe. Botox for migraines, Heidi, it can be very effective. Yes, it can. And Adrian, I hope I answered your question. Said that Robin Williams ended his life. He had a form of Parkinson's. He did. Excuse me. I guess that'll be our terminal sneeze there. I wish everyone a good rest of the weekend. Please, if you haven't already, hit that like button or share with others. Your support helps me do this more often without having to sell ads or do product placement for things that probably don't help you. Rather, this information to help empower you and you be a better advocate for yourself is, I think, far more valuable. So your support means a lot. Thank you so much, everyone.